Good evening, folks. I've got discussion C for you. We're discussing the demand for palliative care is surging worldwide as people live longer but unhealthier lives. Okay, so that's discussion C for you. Here we go. Global surge in palliative care needs. Palliative care focuses on improving quality of life and relieving pain for people with serious, often incurable illnesses. It can be delivered in various settings: homes, hospice, nursing homes, or hospitals. Ideally, well, before end of life stages. Alarming growth in demand. The number of people needing palliative care rose 74% over the past 30 years, reaching 73.5 million in 2021. Lower income countries saw an 83% increase in demand since 1990. Even higher income countries experienced a 46% rise, reflecting broader global health challenges. Access gaps. Despite growing need, millions still lack access to adequate palliative care services. This disparity is especially stark in resource limited settings where infrastructure and trained personnel are often insufficient. This piece underscores a critical tension. Longer lifespans don't always mean healthier ones. And without equitable access to palliative care, many face unnecessary suffering. If you'd like, we could explore culturally responsive models or community-based strategies to help bridge these gaps, especially in underserved regions. The global landscape of palliative care is marked by profound inequities and systematic barriers. Here's a breakdown of the major challenges: structural and policy level barriers, limited integration into national health systems. Only a fraction of countries have palliative care embedded in their health policies or universal health coverage frameworks. Insufficient funding. Many governments allocate minimal resources, leaving services undeveloped or reliant on NGOs and faith-based organizations. Lack of essential medicines. Pain relief, especially opioids like morphine, is severely restricted in many regions due to regulatory, logistical, or cultural barriers, workforce and training gaps, shortage and shortage of trained professionals. Most healthcare workers receive little or no training, no education in basic palliative care, especially in low and middle income countries. Leaving rural and remote populations underserved. Health system limitations, fragmented care models, acute care domains. Many systems with little coordination between primary care specialists, and community based services. Overburdened facilities. Hospitals may prioritize creative treatments even when palliative care or palliative approaches would be would better serve patient needs. Cultural and social inequities, low health literacy, misunderstandings about palliative care, confusing it with euthanasia or assuming it's only for cancer patients, limit uptake, stigma and taboos. In some countries or in some cultures, discussing death or serious illness is avoided, making early palliative care engagement difficult. Marginalized populations, indigenous groups, migrants, and people with disabilities often face compounded barriers to access. Data and evaluation challenges, lack of robust matrix. Many countries don't track palliative care outcomes or needs, making it hard to plan or advocate effectively. Underrepresentation research. Most studies focus on high income settings, leaving gaps in evidence or culturally adaptive models. If you'd like, I can help map out participatory strategies or culturally responsive frameworks to address these gaps, especially in underserved communities. Your expertise in toolkit development and equity driven outreach could be a game changer here. Participatory strategies can radically transform palliative care by centering community voices, cultural contexts, and interdisciplinary collaboration. Here's a synthesis of promising approaches drawn from recent innovations and research. Community-centered design. Co-create care models with patients, families, and local stockholders to reflect cultural values, spiritual beliefs, and caregiving